Mucormycosis or black fungus is supposed to be a very rare condition. But in the wake of COVID-19, it is being more and more commonly reported. We observed this trend and talked about it a few days ago on the India Development Debate, where we talked to top experts explaining what mucormycosis or black fungus is, how can it be prevented, etc. Now, it appears that more and more cases have come to light, so much so that the Health Ministry has written to state governments asking them to actually identify mucormycosis under the Epidemics Act. 3 states have already announced this. These include Tamil Nadu, Gujarat and Rajasthan. Let's listen in to what the Health Ministry has said today.
म्यूकर माइकोसिस को एक नोटिफाइबल डिजीज के रूप में एपिडेमिक एक्ट में उसका जो ऑर्डर इशू किए जाएं उसके लिए स्टेट से हमने कल ही एडवाइस की है। जैसे कि इससे पहले भी कुछ मीडिया फ्रेंड्स ने हमारे से पूछा था उस बारे में, तो उसके थ्रू हमने कहा है कि जिस भी हॉस्पिटल में अगर कोई म्यूकर माइकोसिस का केस आए तो पहला इशू है उसमें तो नोटिफाई किया जाए, उसको हेल्थ फैसिलिटीज को, गवर्नमेंट की पब्लिक हेल्थ नेटवर्क को बताया जाए ताकि हम उसको कंसोलिडेट कर सकें। दूसरा, उसके साथ ही उससे रिलेटेड स्क्रीनिंग, डायग्नोसिस और मैनेजमेंट की जो गाइडलाइंस है जो गवर्नमेंट ऑफ इंडिया ने इशू की हैं उनको फॉलो किया जाए। तीसरा विषय, जैसे कि आपको पता है कि कुछ हॉस्पिटल्स में जैसे केसेस आ रहे हैं उनको ओवरऑल कंसोलिडेट करने के लिए हमने कोविड इंडिया पोर्टल जो हमारा है जिसमें कि हम स्टेट से और डिस्ट्रिक्ट से डेटा मांगते हैं उसमें भी वह फैसिलिटी प्रोवाइड करेंगे कि ताकि जिला स्थाई पर ही स्टेट और डिस्ट्रिक्ट सर्वेलेंस ऑफिस में डेटा भर सके ताकि हम उसे ओवरऑल कंपाइल कर सकें।
All right. So what do we know about mucormycosis? Why has it become a matter of concern now? Are we seeing a large number of cases relatively? Dr. Pawan Ojha of Fortis Hiranandani Hospital joining us on the show to explain more to us. Dr. Ojha, welcome to the India Development Debate. Great to have you here. Tell us why mucormycosis, which is supposed to be a rare fungal infection, has suddenly become a matter of concern.
So definitely it has become a matter of concern because the COVID itself is, mutating, and also at this time, this season, it is causing much more of an immune suppressed state. Other than that, the rampant use of steroids and the not so good control of diabetes are the two main risk factors for this fungus to become an epidemic of this proportion. So, of course, it is a rare disease, and it was also seen earlier, but this time it has become very big. And the important thing is that while we know that the mortality by itself by COVID is only to the tune of 1.5 to 2%, whereas if you acquire this fungus mucormycosis, the mortality goes from 50 to 70 to 80%. So that's why it becomes so important, and it's like almost like a catastrophe if someone gets it.
So, Dr. Ojha, are you observing many more cases compared to before, which has led to a situation like we've seen where there's a shortage of the drugs required to treat it, where states are now declaring it as an epidemic? Are we seeing a big spike in cases over the last few days?
Absolutely. So we have a network of Maharashtra Association of Neurologists that I am a member of. And we have seen over about, let's say, 200 cases which have come up in the last 1.5 months or so. While in the previous season, like last year, there were hardly any cases. So absolutely, there is a real jump in the number of cases. And these cases are more or less coming from those regions where you don't expect so much, happening. So those patients who have been treated in, even in towns, and their treatment with oxygen, steroids, and not so good control of diabetes. So that has caused this to come up in a very massive proportion. And regarding the treatment is in 2 parts. As we know, the first part is to like a surgical treatment to do an endoscopy inside and sort of try and get the fungus out, remove the areas which are affected by doing a surgery. But at the same time, there is also a treatment where you can put in the amphotericin medicine intranasally at that spot, and also take help of intravenous injections of this amphotericin. Now this amphotericin injection comes mainly in three formulations. One is the simple amphotericin B, which is highly toxic. It is to be given over long periods of time. So there are two advancements in this. One, the best formulation which is available is for the liposomal amphotericin. Now each vial of this costs about 7 to 8,000 rupees, and at a time we need to give these patients at least 7 to 8 vials every day. So the cost of the treatment of liposomal amphotericin itself is to the tune of 50 to 80,000 rupees per day, and this treatment is usually, it should last for about 3 to 4 weeks, sometimes 5 weeks. So you can imagine the proportion of the cost of the treatment here, including the surgery. And more or less, it's not so freely available now. It is suddenly this medicine is in demand, and it is probably disappeared from the shelf because of lack of the supplies, and so many other reasons one can easily guess.
Yeah, no, it's hoarding, obviously, is one of the reasons that one can guess, which is a criminal act right now when people are suffering. But look at the costs you're talking about, doctor. You're talking about 70,000-80,000 rupees a day for these injections, which can last into weeks. So clearly, this needs to be something we can prevent. So my question is, A, is it preventable? Because the steroids and the diabetes tends to be a vicious cycle. And B, is this restricted to only those patients who have suffered from COVID?
Yeah. So definitely we have seen in earlier years that these patients who got Mucor Mycosis, they were mainly of three types. One, who were having an uncontrolled diabetes and very bad oral hygiene. The second was those patients who were on cancer chemotherapy and their immunity went down because of those medicines. And the third was those in which they had some chronic illnesses, including organ transplantations, where you gave steroids or other agents to reduce their immunity so that their transplant was not rejected by the body. So these were the three main scenarios till last year. But this year what has happened is, because of these patients who were having COVID, they itself the immunity went down, or when the immunity was hyperactive, we had to give steroids and tocilizumab and other agents to bring it down. And that sort of created an opportunity for the fungus to sort of come in the body, invade the body through the nose. It went up to the eyes. It sometimes goes inside the brain, causes stroke and various other conditions. So that's the substrate, that these are the patients. And those patients who sort of have these risk factors, I would say, suppose they are even discharged and they don't know, they are all still on steroids, they are not taking so much care, not so much awareness about how much tight sugar control should be, not much about the nasal hygiene. And another risk factor was these patients who got oxygen through humidifier, special device which is a humidifier, high flow oxygen. Sometimes these oxygen are also not sterile, these bottles are not sterile, so they can carry the fungus inside and harbor it and allow it to grow. So this is a set of patients that we must be absolutely be careful. And as a doctor community, I would say that we should inform them and sort of warn them that if there is any earliest sign, then they should come and seek medical attention rather than wasting time and allowing the disease to grow very, very rapidly that it does.
Yeah. So what are the signs, doctor? This is important, useful for viewers. What are the signs to look out for? Right.
So this variation of this mucor is called as a rhino-orbitocerebral mucor mycosis, so ROCM. So rhino means it's around the nose. So the virus, the fungus will enter through the nose. Then it sort of lodges in the paranasal sinus. These are air-filled cavities on the sides of the nose inside. So it lodges over there, and it's sort of the spores germinate into a network which is called as the mycelium, the fungus mycelium. From there, when it starts invading the mucous membranes, it can go inside the orbit, so back of the eye, it can start involving the eyes, and from there it can go directly inside the brain, the meninges, and then it becomes very, very critical. So what you see outside is because of, or what the patient notices is because of these three types of involvement. So if only the nose and the paranasal sinuses are involved, then there can be a stuffiness in the nose, or there can be some some discharge through the nose, which could be blood or it could be black. When it goes inside the eye, then the eye becomes painful, swollen, and sort of there may be a difficulty in moving the eye. There can be a drop of the eyelid, or there can be a drop in vision. Whereas once it goes inside the brain, then if it involves the blood vessels of the brain, that can suddenly get blocked and you can get a, damage in the brain, which is called as a stroke. So, someone who loses power on one side or just can't make out what you are saying. So language, limb power deficit, these are stroke. But some patients, they have, other cranial nerves are involved, like facial nerve. So you can have difficulty in moving the eyes, or moving the face, or there can be only be sensory loss around this region, pain around this region. So these are various manifestations. If any one of them is there, one should be on the guard and try and approach the medical facility which deals with these cases on a day-to-day basis. These are large hospitals which are equipped with the the COVID team.
Just one last, doctor. One last question, doctor.
Yeah.
One last question. Today, there are now reports which are emerging of a white fungus as well. Is there authenticity to this? Is there anything like this? And is it related to mucor mycosis?
Yes. So not only you have only mucor mycosis, which obviously causes the blackening of the skin and those surrounding regions, but there are other fungi which are also equally dangerous, maybe just slightly less dangerous than the mucor, but they also cause invasion and all these problems. So these fungus are called as aspergillus and sometimes candida. So three fungus we must remember: mucor, aspergillus and candida. Of course, the mucor, everyone has understood the name and all the repercussions, but the other fungus which also are opportunistic infections in this scenario, one must not forget. So as soon as the doctor utters that this is white fungus, one should not shove it away and say that no, there is no problem. Of course, it can create problem, and it has come because of the immune system is down in diabetics, and that also needs proper treatment.
Absolutely. Thank you so much, Dr. Ojha, for joining us and answering all our questions. I'm sure some light has been shed on this. Just a caveat here, one must not panic. Because of more cases being reported, it does not necessarily mean that this is going to impact everyone. Just stay on your guard and seek medical advice. Thanks so much for speaking with us once again.